Good afternoon, everyone. Thank you very much for coming. It's our pleasure to be here. And my name is Chie Adachi. I work as a professor and dean for digital education within the Faculty of Medicine and Dentistry, Queen Mary University of London. And today we're just going to do a team play. It's been a project that involved students and staff in 2 faculties, and so medicine and dentistry and science and engineering, chemistry. And it's been a year-long project thus far, and we are reporting back on what we are finding so far. So the idea of the project is skills-based education through VR, and how does that manifest in 2 different curriculums. And so if you can go to the next slide, do I move the, yeah. This is a team. As I said, it's a combination of staff and students working together. Enzo is our master's in computer science students, and he's not able to be here today, but he'll be catching up on recording afterwards, I think. Shane is our student from chemistry, final year now, yes, and really driving this project from students' perspective. Pedro is our reader in digital education in medical school. And last but not least is the Professor Lesley Howell. She is a teaching academic in chemistry and really brought a strong sense of what needs to happen in chemistry. And she's been doing a lot of work in AI in chemistry, and so she's sort of the idea person from chemistry side. So the project itself, as I say, it's looking at how immersive technologies like VR can enhance our educational approaches, and how does that translate to different types of curriculum. I think some of the criticism in emerging tech for higher education is that gadget and shiny tech elements and not really thinking about the contextualized use. And so we're looking at 2 particular curriculum in medicine and chemistry. And we selected 2 different types of scenarios. So in medicine, we selected the OSCE. It's a very practical exams that we have. And then chemistry, there are 14 practical skills to be developed in chemistry, and we selected few of those to be to be using VR for application. It's a grant called President and Principal Fund. So it's a £20,000 that we got, and we applied for this at the university level. So it's supposed to be a year-long project, but anyone who has been involved with this kind of project knows that it's not really a 1-year project. So we're going into the second phase of this project. So as I said, this is a reporting back on the process that we've been taking so far. The EdTech partner is Edify. I don't know if you know of this EdTech. They've done a lot of work with the Glasgow University as well, and working in medicine and some of the biomed-based courses. And so we've been working with them, and collaboration has been quite interesting and fruitful. Some of the insights that we share today. So I think with that,
yeah, lovely, thank you. And so we're going to bounce back between Shane and I, because we've devised slightly different things for both of our cohorts, but we're trying to present this to you in a sort of coherent story narrative. So we'll do the same bits. We're going to keep jumping between us. But overall, what we really want to know is, can you teach practical skills in the virtual environment that are then translatable to real life? And whether or not this actually has an impact on our students when it comes to assessment. That's one of our longer term goals, and we're not quite there yet. As he said, these projects run on. But we are able to look at whether or not our students have felt more confident and more able to perform in assessment environments based on what they've done with us in the virtual. So I'll move to the next slide, and Shane will take us through the methodology.
So the methodology, we broke it down into 4 key phases, starting with the pre-intervention focus groups, where we gathered students, asked them questions about what they'd like to see in virtual reality, and ascertained what sort of experience they already had with virtual reality. So after this, we took that information and used it to inform the way we developed our virtual reality scenarios. So you can see here, this is the platform that we're using, and there's a lot you can do in it. Image manipulation, 3D asset manipulation. a lot of work went into designing these environments and making them linear in a way that students can progress through it without getting lost in the environment, which was something that we were concerned about, as they're quite exciting environments. Students could get distracted, so we try and point them towards the specific steps we wanted to engage with. So after we designed these scenarios, we invited those same students back to try the scenarios, give more feedback, and give some informal points about what they liked about the scenarios, what they didn't like about it, and how we can go from there. So the final step is to fully implement these into the curricula of medicine and chemistry respectively, and we're quite close to that. So I'll quickly talk about the scenarios in chemistry. As Chie mentioned, there are a certain amount of skills in chemistry that undergraduate students are meant to know, and these are picked by the Royal Society of Chemistry. There's, I think 16-ish now, and we had to narrow them down to 3. We'd love to do all 16 skills, but it's not very feasible. So after we decided on what skills we were going to focus on, we designed the scenarios to simulate a laboratory environment, as students need to be familiar with the environment that they're in, obviously. But you can see here that we also took some other environments which were a bit more abstract, and we used those to teach students more conceptual things which can align with the lessons that they're being taught. And these step-by-step guides have a whole bunch of interactive elements. We have quizzes, videos, calculators so they can work out certain things. We try and make it so that the student really is engaging with things rather than sort of being led through it. Now I'm jumping to my
And so I'm going to talk about OSCE. So for those of you who are not familiar, I think this is probably the most stressful type of practical examination I've ever seen, where a student is confronted with a scenario that they haven't seen before, but have hopefully tried to practice for. They get a short blurb of instructions, and then they are pushed into a room where they might have a patient, they might have a disembodied arm, for which they have to then role play as a patient. They will have someone in the corner menacingly looking at them with an iPad or a clipboard. And there will be 10, 20 of these going on around them in a room. So it's very noisy and distracting. And they have to do about 10 of these in a row. And not only are they testing their communication skills, you also invariably have to jab a needle into something or do something practical, an examination of a patient. So there's a lot going on, and there's a huge amount of, what should we say, distracting external stimuli that we really wanted to capture. And so one of the reasons why we wanted to simulate an OSCE is because actually they're really expensive to run in real life. You have to get a lot of people together. It's a lot of coordination. The admin is ridiculous. But again, the GMC says we have to do it, so we do it. And so actually recreating that environment and allowing students to dip into it at any point is really, really useful for their learning, because day to day, while they have access to clinical skills room, they can't really replicate the setup, and you can't really do this with just your peers. Because while you can have access to marking rubrics and everything, there's a level of expertise that means you could be practicing wrong and then getting negative feedback, well, positive feedback, but not helpful feedback. So what we did is we took one particular OSCE station that we thought would be fairly easy to do, which is intramuscular injection. So the actual bit where they stick the needle in, it's a environment created through non-interactable models. And so that actual bit is not particularly important to us. What we wanted to do was properly simulate this environment so a student going into it would feel like they're in their exam, and they can practice dealing with that extraneous load such that when they get to the real exam, they can go through it and ignore those external stresses a bit more, because it's become common to them and they're used to it. So what we did was we had very distracting audio playing of what sounds like a very crowded room. We've got the ominous speaker that says your 1 minute of preparation starts now, so they all get that panic going. And our students who have gone through this have told us the adrenaline is there, which is fantastic, and that's what we want, to make them suffer a bit, I suppose. So we're trying to make it as immersive as possible. And you can go through your pre-survey.
All right. So pre-survey findings for chemistry were pretty interesting. So the majority of the students that we asked had used VR before, but only really in a gaming scenario. VR is a lot more prevalent nowadays. Going into it, we tested them. The scenario that they went through was thin layer chromatography, known as TLC. It's a scenario that we picked because there's a lot of elements to it, a lot of variables that you can change, and it's something that students often struggled with. But these students were actually reasonably confident with TLC going into it, which was great. This is in contrast to the medicine students. The OSCE scenario is obviously a lot more stressful than TLC, and as Pedro will mention later on, a lot of them were not quite as confident going into that skill beforehand. So post-survey findings were overwhelmingly positive. 100% of them of students said that they felt more competent and comfortable in performing TLC, which is really great to see, especially as they were already confident going in. They still feel that they benefited from the environment. When asking for comments and feedback, something that came up a lot was the ability to practice these skills in an environment other than the teaching lab, which is a point I'd like to come back to a little bit later in the presentation, as I think it's really, really important in regards to this project. And there's a little quote down there, which basically summarizes their feelings towards the scenarios, how you can practice these outside of the lab and basically increase your efficiency and confidence going into the real thing.
Thank you. So again, like the chemistry students, the majority of us had used virtual reality before. Actually, it's really interesting because I did some research about 4 years ago, and that pie chart was the other way around, and about a quarter of them had some exposure, again, through games and stuff mostly, and not. So we are seeing that trend very rapidly, that people are familiar with this technology. As you see that, a lot of them feel very overwhelmed or uncertain when they're doing the OSCE exams, or they're usually very high stakes and they don't get quite enough time to practice. But what was really interesting, and maybe contradictory to what we thought, was that the top right one there, where they said before using VR, they felt really comfortable with the OSCE environment. I put that down to repetition, because we mostly asked 4th and 5th year students who would have done this now 4 or 5 times in their career, not mentioning the practice time that they do get, and we do put mocks on every now and again. So that was really interesting, because we were trying to make the environment nicer for them, or to get them used to it, but they actually were telling us, no, the environment is actually, within their wheelhouse. So something to think about for us in terms of, is that the angle that we really need to push? But after they had a go at the scenario, they did agree, although I love our medical students because they're all incredibly skeptical and give us lots of yes buts. They really enjoyed the environment, and I think it will help them generally. Some of them found it a little bit too distracting, or they thought the medium just wasn't quite for them. But on the whole, it increases their confidence, and they were quite happy with it. And lots of them want to, have a play around with it in the future. I think a really important part of this technology is that you can access it in a non-immersive fashion. Because when we're thinking about rollout, we've got 500 students a year, 2,000-ish total. It's madness, and we'll never have enough headsets. But you can just do this on a laptop. It's fairly low requirements. You need to use your imagination a little bit more, but you can still get through it and have that experience that we think is really helpful. Sure.
Okay, so now we narrowed it down to a couple of key themes that we'd like to mention, and of course the increased confidence in practical skills, which is the main drive of this project. We saw a huge increase in both chemistry and medicine, which is incredibly encouraging. Second point is interesting, a perceived increase in aptitude regarding future assessment performance. Now the operative word here is perceived, as we haven't actually yet been able to assess them, but they think they'll do well, so fingers crossed. Thirdly, an efficient use of study time. It's always, difficult to read about practical elements. I mean, I'm going back now, reading about chemistry practical skills was difficult, to say the least, but being able to actually practice them feels like a much more useful way of practicing these skills. And easy to use and highly accessible. This is an interesting point. So by accessible, it's all in, I'd say, well, there are definitely problems of accessibility in VR, motion sickness, the headset comfortability. But with these environments, practicing medicine and chemistry, you can only really do them when you're in those environments. So with chemistry, you need chemicals, you need to be in the lab, you need supervision, a lot of barriers to practice. But with a virtual environment, you don't have any chemicals to spill or purchase. You don't need to be in the lab. You can kind of access them anywhere you want, from the comfort of your own home if you wish, which is something that I think is really beneficial. So yeah, we drew up a few conclusions. I'll start with the similarities. Again, I really want to drive this home, the increased confidence in the practical elements. Fantastic, love that. Accessibility, I touched on that. It's far more accessible to do a virtual practical skill at home than to traipse into the lab and get all your PPE on, find the chemicals, etc. And a lot of students mentioned when we asked them about this high potential for use in education. So they don't just enjoy and feel like they benefit from these scenarios, they think that there was great potential for this environment to be used in the future as well. Differences, not too many differences, but a slight competence discrepancy going into them. So the chemistry students were quite confident in their skill going into it, whereas the medicine students were not overall. But they both showed increased confidence and competence. And secondly, as a complete replacement for lab/clinic time, this was quite interesting actually, as the overwhelming majority of chemistry students believed it wouldn't be a complete replacement, rather a supplementary aspect to it. I guess you can't really simulate the smell of acetone that well. But with medicine, a lot of them actually believed it could be a complete replacement for clinic time, which I kind of went for to be the other way around, the human element, but always surprises. And I think that's...
Yeah, I was gonna say, yeah, I was just thinking about our medical students don't really turn up to lectures and might be driving some of their opinions. So increased user immersion is really important to us. So one limitation that we found with our choice of platform is that it's a series of 3D models, and actually you can't physically grab or touch anything. And while you don't necessarily need the feedback from being able to touch stuff, it's nice to be able to move things around in your environment. And so while we did manage to do a couple little bespoke bits where they did animations and stuff for us, on the whole, it feels a little bit like you're in an image more than you're in an environment. So I think there's work to do there in terms of immersion. What we want to do next is look through all of our pilot group data. They gave us so much information on how they felt about the environment. And so we need to build that up. And for example, our OSCE station, we've got it in a simulated ward, and we've got one curtained room. And our intention is, well, we can fill in all the slots until we have a sort of full, hour-long experience for the student to work through, which would be pretty amazing. And then the last one is just to insert this carefully into the curriculum where it fits best. And so for medicine, our students, do these OSCEs from their first year, or maybe from their second year soon. I think we're cutting some. But the point is they get into it pretty early, and it would be great for them to have some exposure before they set foot into the room, or even into the practice version of the room, so we can start building up their confidence and competencies beforehand. So I think that's everything that we had to say. Thank you very much.